Marsha Obermeyer's stomach still does a flip whenever she remembers it. The still dark September morning in 2021 when she felt like she might lose Dean, her husband of 50 years. His cramps were mysterious and painful, but he could still walk. Marsha was able to get him into the car for the 1-mile drive to the hospital in town, Herington, Kansas, population 2,110. Emergency room doctors diagnosed a life-threatening bowel obstruction and airlifted Dean, 74, to Kansas City, 150 miles away, where he was treated successfully. In October, the 104-year-old Herington Municipal Hospital shut down, the victim, it said, of a declining number of patients and lengthy financial struggles. Instead of a 3-minute drive, the nearest emergency room for the Obermeyers is now 30 miles away. You see someone get sicker by the minute. You get those awful feelings that this is it, they're not going to make it, Marsha Obermeyer says. Seconds count. The slow winnowing of rural hospitals, about a dozen a year, have closed since 2010, according to the University of North Carolina's Sheps Center for Health Services Research, may be manageable considering there are 2,282 of them around the country. That sounds like a lot for a rural population of 60 million. But the closures mean people living in the country in 2018 had to drive 24 miles on average for inpatient care, up from 3.4 miles in 2012. There's also what Chad Austin, CEO of the Kansas Hospital Association, calls increased uncompensated care costs. Countless facilities remain open but, starved for cash, are cutting staff and discontinuing services. 5 years ago, a brilliant but difficult entrepreneur from Quebec named Sylvain Raynes came up with a solution. Use a marvel of financial engineering called securitization to get healthcare providers paid quickly, instead of having to wait 3 months for a bit more cash. His method would turn the country's $2.6 trillion medical receivables market into assets that investors could buy and sell. The money would free hospitals from having to borrow and keep them away from private equity firms, whose profit-first ownership is generally not so great for patient outcomes. His North Carolina-based startup, Collateral Velocity, had attracted $1.6 million in funding, more than enough, he said, and in 2022 the product would have been ready for beta testing at 3 hospitals. But like countless visionaries, his plan came to nothing. His Collateral Velocity partners decided at a critical moment to head in a different direction, stranding Raynes without a way to bring his innovation to market. A seemingly ill-timed business decision had remade his success story into an epic tale of lost opportunity. But first, horse semen. In 2005, a group of investors approached Raynes to see if he could help raise money for their stud business. By that time, he was already becoming a celebrity in the corner of Wall Street devoted to structured finance.